Ozark, Missouri. Much of my broadcasts are done spontaneously. These are not prepared talks per se, but they're topics of interest, they're timely topics. And today I want to talk with you just very briefly about a study that was just released, and I have the press release in front of me. I'll give you the reference. It's very, very exciting. Hadassah Medical Center and Neurogenesis announced groundbreaking results from a phase 2 study in progressive multiple sclerosis treated with NG01 autologous cells therapy. Wow, this is a big topic, and I'm going to break it down for you a little bit. But what we're going to talk about once again is the role that stem cells, your own cells that are housed in your body, meaning they're not coming from someone else, not coming from an animal. There's no chance that your body is going to reject these cells, and they play a critical role in healing the brain. Now, these are still investigational treatments. These are not FDA-approved treatments. These are not covered by insurance, but there are opportunities to jump on treatments like this now if you have a need. So this piece came out, is dated December 8th, 2020. Neurogenesis, a clinical stage biopharmaceutical company advancing innovative stem cell therapies to combat myelin-related neurodegenerative diseases. Now, what does that mean? Well, myelin is the conductive coating over the nerve cells. It enhances their electrical signal, and when you have diseases like multiple sclerosis, the initial attack is on that myelin coating. So sometimes we say demyelinating diseases. And they are inflammatory diseases, they're autoimmune diseases, but what we know about MS is there's often a transition from the more purely inflammatory state to the degenerative state where we start losing a lot of nerve cells. And in fact, we don't often talk about things like dementia and multiple sclerosis, but I can assure you that the medical literature is full of articles about cognitive decline, memory loss, and other aspects of dementia as it pertains to multiple sclerosis, because this is a reality, and this is one of the many reasons why we need these disease-modifying approaches. Notice I say approaches because it doesn't always involve drugs. Disease-modifying approaches to conditions like multiple sclerosis, because what we need to do ultimately is not only help you return to normal or optimal function, but we need to hold off this neurodegenerative process and prevent devastating conditions like dementia from occurring. So this company called Neurogenesis, along with Hadassah Medical Center, announced on the 8th, highly positive results from a placebo-controlled phase 2 clinical trial headed by Professor Dimitrios Karousis, together with Dr. Petru Yoita, or Yota, I'm so sorry if I'm not pronouncing these names correctly, and Dr. Ibrahim Kassis from the Hadassah Medical Center in Jerusalem, Israel, assessing the impact of NG1, that's just the name of their proprietary stem cell approach, autologous proprietary subpopulation of mesenchymal stem cells on patients with progressive multiple sclerosis. So these stem cells are harvested from the patient's bone marrow. That's where we find them, and we can do that right here in Ozark, Missouri, where we take you over to our regenerative medicine center, and we numb up your skin. We kind of help you get relaxed. It's not a terribly uncomfortable procedure as long as you are relaxed and numbed appropriately. We use an ultrasound device to identify an area of the pelvic bone. It's very easy to access. The skin tissue layer is very thin there, and we can make a very small incision and use a device that allows us to easily enter into the bone marrow within that bone, and then use a syringe to draw out some of that bone marrow. We then need separate technology to actually separate the stem cells from the rest of the cells in the bone marrow, and this is exactly the technique that's being done in this clinical trial. Now, going on in this press release, it says the results were recently published in the journal Brain. This is a prestigious peer-reviewed journal published by Oxford University and highlighted in the editor's choice. So I always emphasize that everything we do here at Charlotte Health and Neurology is not only science-based, but it's cutting edge. And it's so important for folks to be aware of what's going on here. You will not find this type of approach to neurology medicine anywhere else. Really, I challenge you to show me anywhere else in Missouri, and few places around the country, around the world, who are doing all of the things we're doing today, where you can access the science. You don't have to be the placebo in the placebo-controlled clinical trial. You can come in and understanding that some of these approaches are investigational. If you're willing to be a part of it, I can assure you the safety is there, and you can get involved in the type of treatments that can actually change the trajectory of your brain disease. So how did this study turn out? Well, first of all, there were no serious treatment-related safety issues, none. There were significantly fewer patients experienced a treatment failure, i.e. that it didn't work, in the intrathecal and intravenous treatment groups compared to those in the placebo group. So in this study, there was an IV group where they would give you the stem cells in your vein, and then there was a group where the stem cells were administered right directly into the spinal fluid. That's what we do here at Charlotte Health and Neurology. We do not use IV treatment. So number one, again, we can show you that this type of treatment, when administered into the spinal fluid, it can be an efficacious treatment when we're targeting injury of the central nervous system, and we're using the body's natural mechanisms to repair injured tissue. So how did it turn out? 58% of the treated intrathecal group with the NG01 did not show any evidence of disease activity. That's called NEDA, no evidence of disease activity, during the entire treatment period, versus 9.7% in the placebo group. That's a highly significant difference. Imagine that if you were getting placebo, only 10%, under 10%, would show no disease activity, whereas 58%, almost 6 times the number in the placebo group showed, 6 times the number of the placebo group that were actually receiving stem cells into their spinal fluid showed no disease activity. The NG01 treatment group demonstrated a significant improvement in walking ability as measured by the 25-foot walking time. And if you have MS and you come to Charlotte Health and Neurology, we're going to do your 25-foot walk, and we're going to remeasure that as one way to know that your treatment is working for you. Intrathecal administration of NG01 was more efficacious than intravenous in several key measures of the disease. Relapse rate, an 89% decrease in the relapse rate. 89%. Functional MRI, improvement of motor networks, monthly changes of the MRI T2 lesion load, and the 9-hole peg test as compared to the controls. This is very dramatic. By the way, we do the 9-hole peg test too here at Charlotte Health and Neurology. If you're going to go to one of the other clinics in town, they're not going to do that 25-foot walk. They're not going to do the 9-hole peg test, and they're certainly not going to offer you the choice of having stem cells to help in the repair of injured brain tissue. So we do have access to MRI, of course, like many other clinics, but we also have access to a technology called Neuroquant. This is available at one of the here in the Springfield area. It's one of the very, very few places in the state of Missouri where the Neuroquant technology is available. This technology was developed by a company called Cortex, that's TECHS labs. And what it does is it takes what would be a very inaccurate and time-consuming task by a radiologist to actually measure the volume of multiple regions of the brain, and it turns that over to a software-based artificial intelligence type program that can do this automatically and within minutes. So when we look at brain volume, we're circling back around and talking about neurodegeneration. Remember, time is brain, and with these diseases, you lose more brain over time. We want to know not only where you are at baseline, so we have that initial measure, but as you go through treatment, we can repeat that MRI of the brain, not only measuring the areas that light up, we call them T2 lesions, that's very classic in multiple sclerosis, but we can actually look at the rate of volume loss or the actual volume loss in the brain over time with these treatments. You won't find that anywhere else. The treatment was well tolerated, and the trial met all of its primary endpoints, said Dr. Carusis, the lead principal investigator. The patient improvement was in many cases quite remarkable and included a regain of motor function and noticeable effects on their cognitive abilities. Dr. Carusis added, although we currently have several good treatment options for relapsing, remitting multiple sclerosis. Now, just a little primer here that the disease MS can be divided into different types of different categories depending on disease progression. The most common that we see is called relapsing remitting, where individuals have these discrete attacks. They might lose vision in one eye, develop a facial pain syndrome, have slurred speech, might have changes in their balance, things like that. And then it gets better. The problem with the relapsing remitting, among other things, it doesn't always get better 100%. So over time, there's this accumulation of imbalances in the body, imbalances in terms of how you can function, whether you can move your arms or your legs, how well you can speak, how well you can control your bladder, how well you can see. So it's an incredibly debilitating disorder. And it comes again most commonly in attacks. In the progressive forms of MS, whether that's a primary progressive or secondary progressive, that essentially means that instead of having discrete attacks, there's just a steady decline over time. The difference between primary and secondary progressive is that primary progressive never has that relapsing remitting phase, whereas in secondary progressive, these individuals start out with more of the discrete attacks, but then there's a transformation in the pattern of their illness to the point that they will have more of a steady decline over time. So we actually have a number of treatments available. They're not perfect. They definitely have varying degrees of efficacy, but we do have a number of treatments currently available for the relapsing remitting pattern of MS. We have very limited treatments for the primary and secondary progressive forms of MS. So again, the neurogenesis technology entails collecting bone marrow from the patient. That's a pretty simple process. If done with someone who's experienced, it can take, probably from the moment you're on the table and getting numbed up, and we've identified that area for the actual bone marrow harvest using an ultrasound device, probably take altogether maybe 20 minutes, 25 minutes, 30 minutes at the most. Then utilizing this proprietary process, this particular company can take that harvested bone marrow, not only separate out the mesenchymal stem cells from the rest of the cells in the bone marrow, they can culture them, they can enhance certain aspects or certain behaviors of the stem cells that give this company their proprietary process. What that means is that these cells that have the ability really to find injury and address inflammation in different parts of the body, whether that's the lungs, whether that's the heart. It can be used for congestive heart failure, whether that's inflammatory eye disease. In this case, what happens is that these cells find their way to that area of injury, and then they start to change, where what happens is they will express growth factors and other signaling molecules that are specific to that tissue. And so in the case of NG01, what they're doing is they are manipulating these cells so that they possess what are called neurotrophic, immunomodulatory, and neuroprotective factors. So they are expressing growth factors that are specific for the brain. But what's very interesting, and there's other literature that we'll talk about more in the future, is that not only can bone marrow cells, stem cells, find their way from the bone marrow all the way into the central nervous system, but that it appears, based on the literature, that spinal fluid itself, that fluid that sort of bathes and cushions the spinal cord in the brain, is actually biologically active tissue. What that means is we've, for years we thought, well, spinal fluid is just, you need it because, obviously the brain sort of floats in that fluid. It's kind of protective, but actually it's biologically active, meaning that it has a direct effect on these cells. And so these cells enter the spinal fluid and they sort of go, oh, we're in the central nervous system. And that means we need to start to change and to express these neurotrophic factors just by being exposed to the spinal fluid. So the environment influences the cells. Who would have thought that to be the case? Well, so what does that mean? So first of all, kudos to the folks at Neurogenesis and Hadassah Medical Center. Their type of approach is very similar to that being done by Brainstorm Cell Therapeutics using their Neurone technology, very similar to that being done at the Tisch Research Lab in Manhattan, New York, that are now in their phase 2 trial for progressive multiple sclerosis, very similar to the work being done in South Korea with that nation's equivalent to the FDA having approved a treatment for amyotrophic lateral sclerosis, or ALS, sometimes called Lou Gehrig's disease. These are all the same principles, all very similar technologies. But I would add the little asterisk that whether or not we need to manually manipulate these cells versus simply introduce them into the spinal fluid and let the spinal fluid do what it actually naturally biologically does, that is another question. We don't have the answers to that question. We don't have any kind of study that directly compares simply taking harvested stem cells and introducing them into the spinal fluid and then letting the spinal fluid influence those cells and cause the expression of these neurotrophic factors and neuroimmunomodulatory, big word, but means just control inflammation in the central nervous system, whether that would happen anyway. But as we are in a world where having proprietary techniques kind of drives the economy, what ends up happening is that in order for companies to justify themselves and what they do and to be able to sell their product to help other people, and they do, so that's very important, they have to have techniques that are trademarked, copyrighted, proprietary, or unique to them. That way they get the investors, that way they get the clinical trials going, and they have an opportunity to show that their treatment based on evidence-based medicine is effective. We don't have that right now with simply introducing stem cells into the spinal fluid. However, especially in comparison to these other treatments, however, there is scientific basis for thinking this might be the case. So, Charlin Health and Neurology has expanded over the last several months to not only include conventional neurology, where you can come in, see a neurologist within a couple weeks, try getting a neurology appointment in town at some of the other big places where you may have to wait months or a year simply for a neurology appointment. But I will see you within a couple of weeks. We will take time with you. I take time with you. I listen. How about that? A doctor who actually listens to you. And we'll work through whatever we need to do using the appropriate testing to figure out what's going on with you. We need to identify that problem first. Then we have options that include functional medicine. We have clinical trial research here. We can use conventional medicine. I can refer you to a surgeon if it's a surgical problem. The key point number one is that we do have many options here and that these options are not necessarily mutually exclusive. So if you said, hey doc, I'm in a stage where I do think I really need the medicine, or I might even say that to you. I think that, with where you are with your condition, that it is most appropriate to use medication right now. But the difference is we can put you through our functional medicine program and actually help you to address the root causes of that condition so you might not need the medicine in the long run. That's really how medicine should be practiced. But after all, again, that's typically not how medicine is practiced. So when your doctor puts you on blood pressure medicine, you say, okay, doc, I'm willing to take this medicine. How long do I have to take this medicine? Guess what? You're a customer for life in that case. Well, it's different here at Charlon Health and Neurology. You're not that kind of customer for life. The only kind of customer for life we'd like to have is the one that we can help stay on their trajectory, doing that diet, lifestyle, movement, identifying the root causes at the biochemical, cellular, genetic level through some very deep dive testing that's unique to what we do here at the clinic, and then guide you through the step-by-step changes, standing shoulder to shoulder with you. It's very different than telling you what to do, is working with you so that you feel like we're a member of your team, your care team, to really change the direction of your life and the disease that too often has taken center stage, and too often folks feel like their whole life is being defined by that disease. They say, I'm really much more than my disease. I am, Ken, Dr. Charlon, or I am, Donna, what have you. So we want to get to know you. This is patient-centered care here. Our newest addition to our clinic experience here is our Neuro Fitness Center. You've seen Pamela Hernandez several times on the Wednesday morning Facebook Live talking about neurofitness. If you haven't, definitely check her out. She's a superstar. And she's right now doing the 12 days of neurofitness. So jump on that as well. That's a free opportunity for you to get some great tips leading up to the Christmas holiday. Finally, just about to open, Charlon Health Regeneration Center and IV Therapy Center, where we will be offering bone marrow-derived mesenchymal stem cells administered intrathecally for injury and repair of the central nervous system as it applies to a variety of disorders. In addition, will be the go-to location for IV treatments, including medications that have to be administered IV. Hey, we're in the COVID-19 era, and who wants to walk through a giant hospital clinic building where thousands of people pass through those doors every day, risking exposure to COVID-19? At Charlon Health Infusion Center, you're going to walk in the door. Within a few steps of the waiting room, it has 2 chairs in it, folks. It's not a big waiting room where you're going to be going in and sitting with a whole bunch of people wearing masks and breathing the air that they're breathing. Nope, we're going to take you right back to a private room where you have an IV chair, television. You can bring your iPad, your phone, your laptop. You can enjoy some comforts. We'll play music. Whatever it takes to keep you comfortable, where your personal provider will be helping you with the IV medication that you need. And guess what? We'll also be offering some IV nutrition there as well. So check everything out. You can see the website at the bottom of the screen, functionalmedicine.doctor. Like me on Facebook, like Charlon Health and Neurology on Facebook, like the Charlotte Health Neurofitness. It's a private group, but hey, we'll let you in if you ask. Just shoot us a request, and you are welcome to join the group. So I'm Dr. Ken Charlin. I hope you enjoyed this Wednesday morning Brain Bites on live. We went 25 minutes, so a little long, but so much interesting stuff to talk about. We'll see you next week. Bye-bye now.